Good afternoon, Mr. Williams, and pleasant good afternoon to all who are present and who are tuned in to this program. The COVID-19 pandemic has been affecting us for over 2 years. The COVID-19 pandemic has impacted health across the world, across the globe. It has impacted our health system in the Federation. It has impacted our economies, the livelihoods, and the earning potential of our people. The COVID-19 pandemic has impacted social life as we know it. We are no longer able to attend functions like we used to. There are so many restrictions. The COVID-19 pandemic has impacted us psychologically. We are social beings and we yearn to get close, to hug and kiss and interact with our friends and loved ones. But on the other hand, we have to maintain that adequate space and distance between ourselves and others to protect our lives or to protect ourselves. The COVID-19 pandemic has impacted the education sector at all levels, the tertiary level, secondary level, primary level, and even at the early childhood stage. Students have been asked to adjust their minds to learning virtually as opposed to face-to-face. COVID-19 pandemic has impacted all facets of our lives. We are tired. We are tired of COVID. The year 2021, during 2021, we experienced much frustration and anxiety as we maneuvered our way through the second and third wave of the COVID-19 infections. The pandemic disrupted our lives. And again, as I said, our children have been impacted. Children develop through interaction and socialization with their peers, and this has been hampered. If you look at the news today, we see what's happening in Canada. We are tired of COVID. This afternoon, I want to focus on hope for 2022. COVID-19 is not going away anytime soon. However, we are hopeful that the emergency phase of the pandemic will end sometime this year, 2022. In other words, COVID-19 will become a mere endemic disease. And this will occur because of the high level of immunity from the vaccination rollout and immunity from natural infection. We are certainly not out of the woods as yet. COVID is still a serious threat to the most vulnerable. Dr. Wilkinson just spoke about that. We've lost 11 of our older adults recently. And so we are definitely not out of the woods. And the older adults amongst us remain vulnerable. However, the majority of us are well protected with highly effective vaccines, and we have a much lower individual risk of ending up in the hospital. And so because of the combination of the vaccines and the increase in knowledge about COVID and how to treat COVID, the hospitalization rates and the death rates are much lower than in 2020 and 2021. And so, ladies and gentlemen, there is light at the end of the tunnel. And so for 2022, there is hope that we will approach some level of normalcy. There is a realistic prospect that 2022 will be the year we can begin to live with COVID. without much of the fear and anxiety that marked 2020 and 2021. But the most important thing to note is that the COVID-19 vaccination continues to be our strongest line of defense to the pandemic. The COVID-19 vaccination continues to be our strongest line of defense. It provides our people that added layer of protection against moderate to severe disease, adequate layer of protection against hospitalization and even death. And we have to underscore that. And so it's almost 1 year since we've rolled out our COVID-19 vaccination program, and to date, 82.3% of the adults in our population have received the first dose, and 76.9% have received the second dose. 8.8% of the adults have come forward in terms of requesting the booster shot, and we are happy for this. Please note that if you've received the primary dose or the primary series, meaning your first 2 doses of the COVID-19 vaccine, and 5 months has elapsed, you can easily come in and request the booster. 18.3% of our children 12 to 17 years have come in and received their first dose, and 16.1% of the children 12 to 17 are fully vaccinated. We want to encourage the other children within this age band to come forward and get vaccinated. With respect to the entire or the total population, 55.5% of the total population is fully vaccinated. In St. Kitts, 80.4% of the adults fully vaccinated, and in Nevis, 67.4%. In terms of the children, 17.1% of those 12 to 17-year-olds fully vaxxed. In Nevis, 13.6%. We have yet another global or international target to achieve. Let's remember it was around, October last year. St. Kitts was one of the first territories in this region to pass the 40% mark, or the 40% coverage mark. Now, WHO has set yet another global target. The aim is for all territories globally to achieve the 70% coverage with COVID-19 vaccines by June of this year. So, ladies and gentlemen, we are well on our way. Already 55.5% of our population fully vaccinated. We just have to go the extra step to achieve this global target. Now, in terms of what we are doing on the ground to contain the 4th wave, we are doing quite a good job. Within this past week, only 42 cases were diagnosed as compared to 115 last week. And we continue to see our cases recover, with 208 recoveries between February the 2nd and February the 8th, as compared to 322 in the previous week. Now, during this 4th wave, between December the 24th to February the 8th, we've added 2,666 cases. In the 2nd wave, we added 500 cases. In the 3rd wave, we added 2,098 cases. And in this 4th wave, we've added 2,666 to our tally. The recoveries, 2,503 of these cases have recovered, and so we are monitoring 175 active cases. To date, during this 4th wave, we've counted 10 COVID-19 related deaths. We are going to update that. We're going to add an additional one this evening. So to date, we've had 11 COVID-19 related deaths in this 4th wave alone. We want to pause at this time to extend our sincere sympathy to the family and loved ones of those who have passed as a result of COVID-19. Next slide. I think we had a question that referred to the number of children who have been impacted by COVID in this fourth wave. And so between December 24th to present, 231 of the 2,666 cases are children, 63 between the age of 0 to 5 years, 65, 6 to 11 years, and those 12 to 17-year-olds, we've had or diagnosed 103 cases in that age band. So 231 children have had COVID during this fourth wave. Having said that, in terms of the Ministry of Education and the education sector, school just opened, and we have been collaborating with the Ministry of Education, and to date we've only noted isolated cases of teachers and students at the early childhood level, the primary school level, secondary school level, who are impacted by COVID. Just isolated cases. We've not noted any clusters as yet. Now, in terms of this fourth wave, as I said, there are now 11 deaths. The slide says 10, but it's 10 plus 1, with 10 SINKITs and 1 NEVIS. All the recent deaths, they were unvaccinated. And the age range, they are all older adults, I think between the age of 68 and 92 years. So they are all older adults with underlying chronic conditions. This gives you a summary of the current situation. St. Kitts and Nevis, we've reported a total of 5,488 confirmed cases of COVID-19, and 5,275 of these have fully recovered. We are monitoring 175 cases, with 22 cases active on NEVIS, 153 cases active on St. Kitts. The death toll is, as a result of COVID, overall for the Federation, 38 plus 1 or 39. Total deaths, 39. You realize that males, about 2/3 of the cases were males, just about 1/3 female, and about 90% of those who have died as a result of COVID are unvaccinated, and they have underlying chronic conditions. Just this data tells us that the older adults amongst us, those who are unvaccinated, and those with underlying chronic conditions, including diabetes, CVA, that's stroke or cerebrovascular accidents, and renal disease, they are quite vulnerable and at risk for moderate to severe disease. And so we are pleading to those individuals amongst us, the older adults, please come on board. Please reconsider your position regarding the vaccine and provide yourself that layer of protection against moderate to severe disease. Provide yourself that additional layer of protection against hospitalization and death. If you have not yet taken the vaccine, we are begging you, please, to come on board and give yourself that additional layer of protection. Okay, so the latest information regarding COVID, it was towards the end of November 2021, we heard about Omicron. Now, today, we are hearing that the Omicron variant is not just one single strain. It's now a family of 3 strains or sublineages. Okay? So Omicron variant is no longer one strain, it's now a family of 3 strains or sublineages. And so you have the BA1 strain, the BA2 strain, and the BA3 strain. So the BA1 strain is the original Omicron variant or strain that came to the fore in November of last year. And then the BA2 strain is now, being found and identified in an increasing number of countries, and it's giving the BA1 strain stiff competition, and it seems to be even more transmissible than the BA1 strain. The BA3 is the newest one, and it may be just 100 or 200 cases identified so far. And so the BA2 strain is identified in an increasing number of countries globally. They are quite different in terms of their mutations. The World Health Organization has not yet labeled BA2 a separate variant of concern. They're still linked as the family of Omicron variant or Omicron strains. The WHO officials have repeatedly warned that new variants will arise as Omicron spreads across the world at an unprecedented rate. And so the latest information in terms of the characteristics of BA2 will unfold over the next few days and weeks. Ladies and gentlemen, the COVID-19, the non-pharmaceutical measures remain very, very important as we try to contain this 4th wave and to protect ourselves from COVID in terms of accepting the vaccine, which is our best line of defense. You're wearing your face mask, maintaining hand hygiene and adequate distance when in public spaces and when attending meetings, functions, school, and church, funerals, etc. And very important, if you are experiencing any of the COVID-like symptoms, we want you to stay at home and get tested and not intermingle and interact with others to spread. What are these signs and symptoms? Backaches, aches, muscle aches, pains, fever, chills, feeling extremely cold when everyone else around you seems to be okay, coughing, sore throat, stuffiness, runny nose, coughing, and shortness of breath. These are some of the main signs and symptoms of COVID. If you're experiencing any of these, please, please stay at home, not intermingle, get tested. Thank you.
Thank you, Dr. Laws.